We know that congenital heart disease is the most common birth defect, affecting around 1 in 100 live births. We know that 25% of babies with congenital heart disease will require life-saving surgery in the first year of life. But what we often don't talk about is the fact that 1 in 3 children with congenital heart disease will experience a mental health condition, whether it's neurodevelopmental or psychiatric. And the lifetime prevalence of anxiety and depression in adults with congenital heart disease is 50%. That's 1 in 2, which is a strikingly high rate, much higher than in the general population. And so in our field, in congenital heart disease, we're working very hard to better understand the factors that contribute to these adverse mental health outcomes. We're looking at genetics, at cardiovascular function, we're looking at stress, we're looking at early adversity, we're looking at neuroprotective mechanisms to better understand that interconnection between heart and mind. Our program is dedicated to working before children are even born. So we start at the time of prenatal cardiac diagnosis, working with parents who receive their baby's diagnosis during pregnancy, and work throughout the lifespan. Continuity of care is something that we don't see in many places, and we know, and our patients tell us, is absolutely vital. Working with mental health professionals that deeply understand cardiac disease is incredibly important and therapeutic. Cannot make progress unless we're working together, and more there are international collaboratives, international collaborations, and that is the way to move the needle forward. It's normal to be angry that you're in hospital over the holidays. It's normal to be frightened of your upcoming surgery. And the more and more we're able to normalise these very understandable responses to abnormal situations, the more that we can melt that stigma. Our research has shown that depression amongst people with congenital heart disease is associated with biomarkers of inflammation, biomarkers of heart failure, and a 3-fold increase in mortality. Side by side, research this year has shown that when patients with heart disease have access to mental health treatment, we see a 75% decrease in readmissions, 75% less likely to present to ED, and a 65% less likely to die of all causes.